Right. Hi, everyone. My name is Dr. Mataa Moses Mataa. I am a physician currently working at the University Teaching Hospital, specifically in the Department of Internal Medicine in the neurology unit. But I am also one of the co-founders of MedSearch Zambia. So today we thought we would just have a chat. For those of you who have been watching, you have probably noticed that we have started having these live chats every week on different topics as MedSearch Zambia, which fits with what we are really trying to do, which is just share information. At MedSearch Zambia, we believe in trying to help to make healthcare simplified. And a big part of that is just by sharing information, correct information. So we will continue to bring different people, relevant people in different fields to talk specifically on different topics. Hopefully, this will increase our knowledge as viewers, as listeners, and encourage us to be active players in our own healthcare. So today's session is going to be short, but hopefully it will be informative. We've been running posts about the cardiovascular system and cardiovascular health for this entire past week on the MedSearch Zambia page, and that is part of what we're going to talk about today. Now, to begin with, we really want these sessions to be very informative and very interactive. We do not want them to be us just talking to people and telling them what we think they need to know. So we're going to focus more on what are the questions that we as healthcare providers are often asked in the course of our work. And when we talk about cardiovascular health, there are a lot of cardiovascular conditions, too many to even think about discussing in a 30-minute session such as this. So today I thought we would start by talking about probably one of the most important ones that we all should really be aware of, and this is hypertension. So that is what today's talk is going to be about. We're going to just have a chat about hypertension. We'll talk about what it is, how does it come about, what are some of the symptoms that perhaps someone should look out for that could point towards them knowing if they are hypertensive. And why does hypertension matter in the first place? Why should we even be bothered and think about hypertension? And we'll also talk a little bit about what to do if you are diagnosed with hypertension, whether it's you or a loved one may have been diagnosed with hypertension, and why it's important to talk about hypertension, how to manage it, how to control it, so that we can live our best lives as much as possible. So to begin with, I think the first question is always, what is hypertension? And hypertension is just a way for us to say high blood pressure. I think that's probably the way most people, when we think about hypertension, you may not have heard about hypertension, but most of us have heard about high blood pressure. Oh, I went to the clinic and they told me my blood pressure was high. But what does that actually mean? So when we think about our cardiovascular health, and I want us to think about that in terms of our heart health, because that is right at the center of the cardiovascular system. We have this amazing organ in our chest that is pumping blood from before we are born until the last day that we breathe our last, and it is pumping blood throughout our bodies, and it is in that blood that we're able to get the oxygen that we need to all our organs. It's in that blood that is pumped by the heart that we get our nutrients and our oxygen, a lot of wonderful things. So the heart and the blood vessels that come from the heart to the rest of the body and back, bringing back blood into the heart. That is what the cardiovascular system basically is. And when we think about high blood pressure, and I will use the term high blood pressure in this context because I want to use a phrase that most people are familiar with. So whenever I say high blood pressure, I'm referring to hypertension. So I want us to think about it like this. All of us have what is considered a normal blood pressure and a normal force with which the heart is pumping blood to get all these wonderful things to where they need to go. So the problem comes in when the force, the pressure with which the heart is pumping this blood to the rest of the body is higher than it should be. That's when we start talking about high blood pressure. So when you go to your health facility, your doctor, your healthcare provider will be able to measure your blood pressure to find out what your actual blood pressure is. And we talk about certain numbers, which we consider a normal range. So it's usually a range of normal. It's not just one figure that says, oh, this is a normal blood pressure. It's a range, and that range changes depending on a few factors, such as your age. Okay, the older you get, as we grow older, our blood pressures also gradually increase. So what would be considered a normal blood pressure for a 20-year-old would be expected to be different from what would expect to be a normal blood pressure for someone who is 50 or 60 or 80 and above. So as we grow older, our blood pressures do tend to increase. So a lot of the times when you go on the internet, you open a textbook and things like that, they'll talk about a blood pressure reading of 120/80. That is a figure that we have used a lot. Um, it is what is sometimes called an optimal blood pressure, but again, like I said, it really depends on the age of the person whose blood pressure is being measured. Generally speaking, we really would want your blood pressure for most people to be less than 140. So that's a top figure, what we call the systolic blood pressure, to be less than 140. And the bottom figure, what we call the diastolic blood pressure, to be less than 80, 85. And there are certain situations where even as healthcare providers, we want to be a bit more aggressive in terms of how we want the blood pressure to be. So for example, if someone has diabetes, then there we are a bit more strict in terms of how the blood pressure should be. So our targets would probably be much lower, probably around 135 for the systolic. That's a top figure if you're measuring your blood pressure, and definitely less than 85 for the bottom figure. But like I said, blood pressure is really dependent on your age. And then there are other factors such as your race. So we know that certain races tend to have higher blood pressures than others. For example, Africans generally have much higher blood pressures than other races. And this is also true for people of African descent. So for example, in America, even in Europe, you find that people of African descent, so Black Americans, would still have higher blood pressures than people of other races, even if they have the same age. So race is also a factor that plays into what would be considered a normal blood pressure range for different people. So now that we've kind of talked about what high blood pressure is, why does it matter? It matters because our organs inside all of us require certain set levels of things like blood pressure. And once blood pressure starts to go up, then we begin to put ourselves at risk of developing complications because of the hypertension. So it's important when we're thinking about high blood pressure, we start by thinking about what is it and what causes it. So we've mentioned that certain things that are beyond our control do play a part, such as your race. We really do not have control over what race you're born as. So being an African already increases my risk of being hypertensive. And then there are other factors that also impact whether I am at high risk of being hypertensive or not. And one of the big ones are if you have a family history of hypertension. So if you have a family history, and here we're talking about first degree relatives. So if your parents, for example, were hypertensive, either one or both were hypertensive, then you are more likely to also develop high blood pressure. So that's where we find when you come to the hospital, we will ask you, is there anyone in your family who has high blood pressure? We ask about your parents, we ask about your siblings, because we know that there is a genetic component to high blood pressure. So having a family member, a close blood relative who is hypertensive also increases your risk of potentially becoming hypertensive. There are also things right from the beginning, your birth weight. Surprisingly, you might be surprised to know that your birth weight may actually influence whether you end up being hypertensive down the line. So if you had a low birth weight, then it may also increase your potential to become hypertensive later on in life. So these are some of the things we call non-modifiable risk factors for hypertension. You have no control about what race you're born into, or whether one of your parents was hypertensive, or what you weighed when you were born. But then there are also things that we do have some control over, and these are the modifiable risk factors. And these are very important because when we come to talk about what can we do about high blood pressure, these are the things where we do have something we can do about it. So you have things like your weight. So obesity has been known to increase your risk of developing hypertension. So the more overweight you are, the higher your risk of eventually becoming hypertensive. The use of substances like alcohol and smoking, which we do have control over, also increases your risk of becoming hypertensive. Okay. Um, how much physical exercise you participate in on a daily basis also increases your risk of developing hypertension. So if you live a mostly sedentary life, which means you do not perform any deliberate physical activity, then you are increasing your likelihood of becoming hypertensive. There are other medical conditions that also increase your risk of becoming hypertensive. And the big one I would want us to talk about is diabetes. And this is particularly important in our setting because we are seeing that hypertension and diabetes do go hand in hand. So if you have diabetes, your risk of also becoming hypertensive significantly increases. And we've also seen in the reverse, where if you are hypertensive, we are also going to need to look for diabetes in you because we've seen that the two do go hand in hand quite a lot. There has been talk about, does stress increase your risk of becoming hypertensive? So that is an important question to ask. Stress has been in the past associated with hypertension. So any one of us, if we are in a stressful situation, our bodies are going to respond in a way to try to prepare us to either fight or to run away. And one of the ways the body does that is by pumping more blood so that if we do decide to fight, we have enough energy and blood flow to make our muscles work properly. So in an acute setting, our blood pressures in a stressful event actually go up. And potentially, if you are chronically stressed, you are living in a state where your blood pressure is consistently high, and therefore you would meet the definition of being hypertensive. The other important thing tied again with obesity and diet and how we eat is how much salt we consume. And I think this is something that we as Zambians are particularly guilty of. I know I have in the past been guilty of it, where we consume much more salt than we need. And salt has been found to be directly linked to the development of high blood pressure. So that habit that we all have of adding salt to food before we've even tasted it, that is going to come back and cause problems for us down the line, and that is something we really should be working on. And it's small things like that that we can use to control our blood pressure down the line. So those are the things that when we think about risk factors, so it's the things that we have no control over, such as our age, our race, our family, and there are things that we do have control over, such as what we eat, how we eat, whether we exercise or not, whether we take alcohol and smoke, and in what quantities. Those are things that we do have control over. And by reducing some of these things, you may find that you could actually control your blood pressure very well. So one of the things that I'm asked quite often is, and when I'm talking to my patients who are hypertensive, and I ask them, particularly if they have been started on medication, and I'm usually given an answer something like, I know when my blood pressure is high. So can someone actually know when their blood pressure is high? The honest answer to that one is no. Hypertension, high blood pressure, is what we sometimes call a silent killer. I could be sitting right here, right now, with a very high blood pressure, and unless I measure it, I will not know what my blood pressure is. So the notion that I know when my blood pressure is high, my body will tell me, is actually quite misleading. What can sometimes happen is if your blood pressure is very high, your body will start to manifest certain things. So the things that people tend to say they know when their bodies, when they have high blood pressure, like they have headaches or they experience palpitations, that's just the sensation of your heart beating. Those, by the time you start to experience something like that, it's telling us that you have probably been living with high blood pressures for a very long time. And the next thing that's going to happen is going to be a devastating, life-changing event for you. So we really should not be waiting to feel any symptoms of high blood pressure and use that as a guide to whether we need to be on medication or not. The only reliable way to know if you have high blood pressure or not is to go to your nearest health facility and have your blood pressure measured. And this needs to be done using correct equipment by someone who knows how to do it. And it's also important that we remember that if I go to a clinic and they take my blood pressure, one reading of a high blood pressure does not mean I am immediately hypertensive. There are obviously certain exceptions to that rule. If you go to the clinic and you have had a complication as a result of your hypertension, for example, you are coming in with a stroke, there I'm not going to wait for another reading because you're already coming in with complications. I'm going to diagnose you with hypertension and start treating you right away. But if you were going for a routine medical examination, for example, and we find that your blood pressure was high, we need to be a bit more careful there before we say, okay, you are hypertensive. So usually what we'll do is we'd ask you to take a seat for a couple of minutes, maybe even hours, and then repeat the blood pressure. If we get two or more readings spaced in time, that just means taken at different times, and we're finding that they are above what is expected as a normal blood pressure for a person of your age and race, then we will say that yes, you are hypertensive. So it's important that we go and have our blood pressures checked. We should not wait until we're feeling unwell before we go to seek medical attention. So once we have been checked and our blood pressures have been found to be high on at least 2 occasions, then your healthcare provider will say, I think you are hypertensive. And then we go into the next stage to say, what then can we do about it? So once I am diagnosed as being hypertensive, so we've taken what we call a history, we've asked you what are your risk factors? Is it a family disease that has been running your parents, your grandparents? Is it a lifestyle thing? And we assure that you are hypertensive because you have had these two readings that are high. What do we then do? So again, here it's a stepwise approach. Okay, there are things that we can do. Remember, we talked about what we called your modifiable risk factors. How much exercise are you getting? What are you eating? Are you living on fried food and chips on a daily basis and you haven't eaten a vegetable in the past 2 years? Are you adding 3 tablespoons of salt to your food before you've even consumed it? So these are the conversations you will have with your healthcare provider. The first step is addressing what we call your modifiable risk factors. If you are overweight, we will look at what your weight is, calculate what's called your body mass index, and set a realistic target with you in terms of how much weight we would want you to lose to bring your weight down to a normal range. And this is important because it's been found that any weight loss for those who are overweight or obese, the mere act of losing any weight actually begins to reduce your blood pressure before we've even added any medication to your blood pressure control. So just controlling your weight starts to control your blood pressure. And then we'd look at what are your eating habits. So we'd want to optimize what's called a heart healthy diet. So a heart healthy diet really focuses on making sure you're getting good amounts of fruits and vegetables. It's about controlling how much carbohydrate we're eating. It's about making sure we're eating healthy fats. So mind, I haven't said that we're going to cut out fats completely because your bodies do need fat, but it's about healthy fats and in healthy quantities. And these are things that we can do in very simple ways, like how you cook and prepare your food. Simply cutting off the skin from chicken drops the amount of fat that you're actually consuming with your chicken. Grilling your food instead of frying it reduces the amount of fat that you're consuming. And importantly, remember we said that salt is a very big culprit when it comes to hypertension. So making sure that we control how much salt we're eating. And this is something as simple as once the food has been prepared, however much salt was added during the preparation process, that is the only salt you add. You do not add any more salt to your food. You will find that in time, you will begin to adapt to having food with less salt. It will still taste good, but you're slowly, gradually reducing the amount of salt that you are consuming. So it's about taking small steps. And also, since we're talking about steps, it's about increasing how much physical activity you are doing. So if you're an office worker and you go from your bed to your car to your chair and in the reverse order at the end of the day, you need to find ways of including some physical activity on at least 3 to 5 days. And here we're not talking about, does not have to be running a marathon. Even just walking for 30 minutes on 3 to 5 days in a week, over time, you will find that that aerobic exercise is very good for your heart and will also help us control your blood pressure. So that is the first step to how we control high blood pressure. It's about identifying that it's there and then working on the modifiable risk factors, working on our diet, working on how much salt we consume, making sure that we are participating in some physical activity, whatever is comfortable for you. Find a gym if you can, or just walk. Walk around the office. Don't spend the whole day sitting. Do some movement. Our bodies are full of joints because we are meant to move. So participate in some physical activity. Safe use of alcohol, preferably cutting out alcohol completely. Definitely smoking, there is nothing good about smoking. There is no such thing as safe use of tobacco. So that is something that if you do smoke, you really just need to think about cutting that out completely. Your life will be much better off down the line. So once we've looked at lifestyle, so we make a plan with you to say, okay, let's make a plan for lifestyle modification. And then, provided you don't already have complications from your high blood pressure, like I mentioned, you've not had a stroke or you've not had a heart attack, then we have a process where we follow you up to see, okay, let's see how this goes, because these things take time. So we may say, let's see you in 3 months' time. Obviously, you're coming to the local clinic or your nearest health facility, which you found through the message app, where you're able to check your blood pressure. And then, if we are happy with the trend that your blood pressures are going, lifestyle modification on its own might be enough. But what happens if lifestyle modification is not enough? Then we have to start talking about medication. And this is something that's very important. Once we make a decision to start treatment in terms of I'm going to prescribe you some medication that you need to take, that is going to be essentially a lifelong decision. Okay, so it's very important that once a decision has been made to start you on medication, specifically for your blood pressure, ask your doctor, ask your clinical officer, ask your healthcare provider to explain what the medication is expected to do. Ask them to explain to you what are side effects that you should be mindful of and how you should be taking this medication. A lot of times we see medication being given for 5 days and 10 days, and then the patient comes back and says, oh, I did not know I was supposed to continue this. That is not the way it's supposed to be. So if we decide to start treating you with medication, that is a long-term process, and that is medication that should not be stopped without the guidance of your healthcare provider. So if your mother, if your father, if your grandfather, if yourself have been prescribed BP medicines, those are medicines that we need to be taking on a daily basis, because as long as we're taking the medication, in addition to the lifestyle factors that we have already talked about, the medicine and the lifestyle factors are working together to control your blood pressure. Once you remove one of those factors, you stop taking your medication, your blood pressure is going to start coming back up. So it's not something that we take as and when we feel like it, or as and when we think we know that our blood pressures are high. So it's about identifying that we're hypertensive. It's about implementing lifestyle change. It's about sticking to medication once we have been started on medication. Why do we need to do all of this? Is so that we avoid the complications of poorly controlled blood pressure. I say blood pressure, high blood pressure, is a silent killer, and it really can be. Unfortunately, before we even get to the silent death part, it can actually negatively impact your quality of life. So hypertension, if not properly managed, can affect your entire body from the top of your head all the way to your smallest toe. Let me explain. One of the emergency situations we see in our hospitals are people coming in having suffered from strokes, and that is a topic that we will discuss at a later time on the MedSearch live page. But stroke is very devastating. It can lead to an immediate loss of life or even to long-term disability where people are not able to walk, talk, and function at all. So strokes, in our setting, actually, we're seeing that strokes are by far caused by poorly controlled hypertension. So if we do not control our hypertension, our high blood pressure, we're putting ourselves at the risk of suffering a stroke. If you don't suffer a stroke, high blood pressure can also damage your eyesight. There is what's called hypertensive retinopathy. Basically, it means that if you are hypertensive for long enough, and if your blood pressures are poorly controlled for long enough, the high blood pressure in the vessels of your eyes are going to gradually damage your eyesight to the point that you could actually become blind. So, like I said, right from the top of your head to your smallest toe. Moving down into your chest, the same organ that is pumping blood is also a victim of high blood pressure. So if we do not control blood pressure well, it increases your risk of developing heart failure down the line. And that is something that we will discuss at a later point. And heart failure in its various forms can also be quite devastating and impact our lives. Our kidneys can also be damaged by high blood pressure, both for men and for women, but perhaps more importantly for men. And just calling back one of the live sessions that we had, we talked about erectile dysfunction on one of our earlier pages. Please look on our Facebook page, look on our YouTube page for that live talk where we talked about erectile dysfunction. But high blood pressure can actually lead to erectile dysfunction and impotence in men. So it is in our best interest for those of us who are hypertensive to make sure that we control our blood pressures very, very well. The other thing, and possibly one of the last complications I would want us to talk about, is what's called peripheral neuropathies. And sometimes people will describe it in different ways. They'll say they experience pins and needles in their feet or a sensation of numbness, ichfungalashi, sometimes we call it. So that is a manifestation of a complication of blood pressure where the high blood pressure is causing damage to our nerves, and this can lead to pain in the legs, a loss of sensation, difficulty walking, all manner of complications. So as you can see, uncontrolled blood pressure can be quite detrimental to our lives, our quality of life. It can lead to complications that can potentially take our life, either in the acute setting, such as if you have a stroke or you have a heart attack, or it can lead to a much more prolonged disease process like heart failure, like kidney disease, or even a disability that comes with surviving a stroke. So it is very important that once we recognize that someone is hypertensive, we do everything in our power to manage the hypertension. So perhaps as we prepare to close, the other question I am asked and colleagues are often asked is, can hypertension be cured? So when we think about cure, um, we control hypertension. We do not necessarily cure it. To say that we cure it means that we take it away and it is gone for good. Unfortunately, hypertension is one of those conditions where unless your hypertension was due to a what we call a secondary cause, and we haven't really touched on that, but there are certain conditions that can cause secondary hypertension that are potentially treatable in that way. But for the most part, all we can do for high blood pressure is to control it with the strategies that we've talked about. But it's about lifestyle modification with diet and salt restriction, increasing physical activity, and for those who are on medication, it's about making sure that they are taking their medication. So we control it, and by controlling it, we prevent or at least delay in the very long term the development of potential complications as we have discussed. So if you are worried that you might be hypertensive or a loved one might be hypertensive, what should you do? The main thing is do not make assumptions. It is best to go and be checked. So again, go to your nearest health facility, your government clinic, your private health facility. Even most pharmacies will actually have the option of you being able to have your blood pressure checked. So you can use our message app to go to your nearest health facility to have your blood pressure checked, and they'll be able to tell you whether it is normal or not for your age, your race, your sex, and things like that. And remember what we said, one reading does not necessarily make you hypertensive, but if we do repeated readings and we find that the blood pressure is high, then the next step will need to be engaged, where we then start talking about, okay, what do we do about it? Lifestyle modification, and if necessary, medication, always in combination. So we do not do one without the other. Even if you're taking medication, you still have to continue doing the lifestyle modification because they work together. Okay.